Hello, I'm Tate Shanafelt, Professor of Medicine and Chief Wellness Officer at Stanford University. Today I'm here to discuss our recent publication, Changes in Burnout and Satisfaction with Work-Life Integration in Physicians and the General U.S. Working Population between 2011 and 2017. These are challenging times for physicians. Consolidation of medical practices, increasing productivity expectations, intrusion of the electronic health record, and greater administration and clerical burden have all increased the workload for physicians and created new challenges to their meaning and fulfillment in work. In 2011, we began surveying U.S. physicians and the general U.S. working population every 3 years to evaluate changes in the experience of burnout and work-life integration in physicians relative to the general working population. We previously reported an increase in burnout and a decrease in satisfaction with work-life integration between 2011 and 2014. In the 2017 study we recently published, we have seen some improvement in both burnout and work-life integration in physicians between 2014 and 2017. Although this is true at the overall physician population level, a more nuanced picture emerges when we look at the changes between 2011 and 2017 by specialty. Some specialty areas have had a steady improvement in burnout over the last 3 years, whereas others still have higher levels of burnout in 2017 than were present in 2011. One would ask the question of why have things improved between 2014 and 2017? Our study can only provide a platform for speculation in that regard, but there are a number of initiatives that have been launched at the national level by the National Academy of Medicine, the American Medical Association, a number of professional societies, and a number of organizations that have developed interventions to try and address some of the challenges physicians are experiencing and lead to progress. Those initiatives likely transmit to physicians that they are not alone in the challenges that they are dealing with, and can also bring a sense of optimism that change is possible and efforts to drive that change are underway. Longer-term improvement will likely require us to realize effective change for further improvement or for the improvement that has been observed to be sustained. Despite these improvements, symptoms of burnout and challenges with work-life integration remain markedly bigger issues for physicians relative to other U.S. workers. Given the evidence suggesting distress in physicians erodes quality of care, undermines patient satisfaction, and can decrease access to care, it will be important for the U.S. healthcare delivery system to continue to try and address these challenges. Research studies have now begun to move beyond a focus only on personal resilience and self-care and to look at how we can improve the practice environment, our systems and workflows to provide better support for physicians and make it simpler for them to provide patients the care that they need. That research will be important as we try to develop evidence-based interventions to reduce burnout, promote work-life integration, and improve professional fulfillment and effectiveness of U.S. physicians.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.